So, Katelyn is our story today.
Mm-hmm. Aw, I love Katelyn's story. It's so good.
Cool. Let's just start with like you meeting her coming into the doors of Align,
Mm-hmm.
and how did she hear about Align, and then how did that all kick off?
Yeah, I think so. Some context. Katelyn was like 13 or 14 years old when she came to us, and it was actually my first introduction was a phone call from her mom saying that she had a really challenging case, that she was staring down double hip and double knee surgeries at 14 years old. And
crazy.
that she was looking for any possible answer to help her escape that future. And she said, "So do you think you can help?" And this is a phone call. I'm like, I've never seen this person. I've never talked to him.
What was her tone like? Was she, I would imagine it's pretty intense. Was she?
Yeah, I mean, I think she's a determined mother who, I don't think desperate is the right tone, but she wanted another life for her child other than starting her off on a path of 4 surgeries in 2 years. Like, it's just wanting to protect her from that. And so over the phone, I'm like, I mean, I need to see her.
Yeah. What is she dealing with? I need to see it.
Yeah,
firsthand.
I need more info, but I mean, I would love to work on the case because it's such a unique circumstance, right? And so when she came in and I saw what she was dealing with, she just had such a biomechanical mess on her hands that I told her mom, I said, you know, I don't know if we can stabilize this, but I would dang sure like to try. And so it wasn't like this grandiose promise. It wasn't, you know, machismo, like, oh yeah, it's like, let's see what we can get done, because the alternative is not a good outcome. So what her pain points were when she came in was she had hip and knee pain, bilateral, both sides, hip and knee pain, low back pain. She couldn't go out for walks. She couldn't ride a bike. She couldn't go up and down the stairs in the house. And she's, you know, going into high school, like wanting to live a normal life.
Nice.
And so she was frustrated and sad, and there's loss there around not being able to do these things, and that's a hard age to go through that type of pain journey.
Since she's so young, like, were you able to get down to like how she got to where she was? I mean, because like there are other clients where it's like they're older in age, and so you can kind of see where those patterns came from.
Sure.
But with someone
Culture
who's young,
leads to dysfunction, leads to degeneration.
Yeah.
But with her, it's not culture.
Yeah.
So she had bilateral hip dysplasia. So she had instability in both her hips that her body responded to with this contracting of her lateral chain, her TFLs, her IT bands, and it just torqued her knees in and then pulled her lower leg, her tibia and fibia, out. And so her feet were pointed out, her knees were turned in, and her pelvis was severely unstable.
Is that something that, I mean, you said the term, I already forgot it.
Hip dysplasia?
Yeah, is that something that's common for people, or is
Not real common.
Oh, okay, cool.
Not real common. Most cases that we see with that type of torsion through the knee and this kind of twisted mess are just cultural adaptations to a lack of movement variety.
Gotcha.
But for her, it was not that. It was instability through a congenital, natural, bony structure, instability through the hips that led to this unoptimal stabilization pattern that was just wrecking her.
Okay. What was her feeling like during your first evaluation with her? I mean, because it was in person, right?
Yeah.
Was it?
Yeah, it was in-house.
Yeah.
She's so cute. She's just like, you know, didn't want to have surgery, sort of shy, reserved. game to try anything, but also, I think there was some hesitancy and some insecurity in that area of movement, and
Right.
I mean, when that's an insecure age already, and then to throw like dysfunction and inability on top of that, that's so hard emotionally. I think that's one of the most impressive parts of Katelyn's story is just how amazing she was mentally. Like her mental process was just so impressive. Like she, and we can all learn from that. She came in clean slate and said, I want your help. I don't have conceptions. I don't have preconceptions or misconceptions. I just want to walk with you through this and trust you and let me lead you.
Wow.
Right? Which is huge. And then she did the work.
Yeah.
I mean, for a 13, 14-year-old to just show up and do the work is hard. I mean, her journey lasted, I mean, she was with us for years, but like her journey of like getting pain-free was fairly long. It was like probably 18 months.
Okay.
And she was putting in the work 3 days a week, 4 days a week.
Gotcha.
Like, it was awesome.
That's cool.
Yeah. And I think there was a really memorable time in my mind, when she kind of got a little bit relaxed and didn't do her program for a week, 2 weeks. You go on vacation, and then it takes a week to get back in, and then she was hurting, and she's like, I don't understand why some people can go do whatever they want, never take care of their body, and have no pain. And then me, if I take 2 weeks off, I end up hurting.
That's a great question.
Right? And I had to teach her that we're all dealt certain cards. And we have to play the hands that we're dealt. Okay? And so for her, she is prone to instability through the hips, and she is prone to general hypermobility. She's very, very flexible. So she's prone to being too mobile. And so she has to spend all of her time, not all of her time, but all of her time in training, getting stronger and tightening really critical muscles up in order to stabilize her structure.
Whoa, okay. That would be cool to explain a little more, because I don't know if, at least for me, speaking for myself, I don't know what other people know, but the hypermobility isn't always just a signal of like good health. Like you got to balance it out sometimes. So
all the time. Yeah. Hypermobility is a condition that needs to be battled against. And so some people are genetically more predisposed to being more mobile, and then some people are more predisposed to being stronger genetically.
Gotcha. So there's a little bit of a spectrum there. People can land. And so if you tend to be stronger and tighter, you have to spend more time consciously training mobility. Right.
And if you are
Mobile.
more mobile, you have to spend time consciously creating stability. And so everybody's dealt a hand of cards, and we have to play them strategically and proactively to create balance in our musculoskeletal system. And so for her, she was so hypermobile that she has to work 3-4 times harder than anyone else her age just to get back to neutral, just to get back to normal, just to get back to functional. And she had a process of like grieving that and being angry about that, which I think is super healthy. And then she accepted it, and she almost she took ownership of it. She took ownership of her body, and she said, I'm going to spend the time getting strong. I'm going to spend the time doing what I want to, doing what I need to do, so I can live the life that I want to live. And that's, I think, what's so powerful about Katelyn's story, is that stepping into stewardship and ownership of her body, and at such a young age. I mean, it's awesome. She's super great.
That's cool. Was she one of the younger clients that you had?
One of the younger ones. I had a 9-year-old with real severe low back pain.
Okay.
But she was definitely one of the young ones for sure.
Cool. Do you want to touch on, I guess maybe just a few things program-wise that you maybe stood out to you while she was in the program that you felt like were turning moments, or like, because it would probably take forever to go through her whole program, but
Sure.
like maybe some high-level stuff that was like, oh, okay, these were key turning points for her while she was here.
She had one of the most dramatic feedback loops between her feet and her hips that I've ever seen.
What does that mean?
So everybody has a feedback loop between your hips and your feet that either create better function or create more dysfunction.
Okay.
Okay. So when a glute atrophies, let's go over to the demo lab.
Let's do it.
When a glute atrophies and then you go and walk and stand on one leg, your knee will buckle.
Yep.
Your knee will turn in. Okay, and that's because this muscle, your TFL, is pulling through your IT band, and that pulls it tight. Well, what happens is that arch, see how my arch is collapsing?
Yeah, automatically, I got you.
So the arch collapses automatically. And so your hip issue can cause foot issues.
Right.
Okay, but if you have weak intrinsic stabilizers of your arch, okay,
Yep.
see how nice strong arch there? Okay, if I have weak muscles in my arch and my arch collapses, then that will push my knee internal and that will create my hip issue.
Okay.
And so the feedback loop is hip issues can cause the foot collapse, or the foot collapse can cause the hip issue.
Gotcha.
And so most people,
Do you worry about the knee in the whole game, or is it these two pieces that are your things you're focused on, because the knee is going to follow suit?
the knee follows suit.
Gotcha.
That's the dumb joint in between the smart joints.
Right, which I've heard you mention before.
Yeah, the knee will go wherever it's told to go.
Gotcha. So that's why you kind of call it that feedback loop, because it's like that. Those are the, main points of.
Yep. And so for her, she had this really strong hip instability causing feet issues.
Okay.
And we were just like working on the hips. And then we were like, okay, it's slow. We're making progress, but it's slow. And I'm like, let's really start hammering feet hard. And then everything just went whoop right to where we wanted it, and everything stabilized, super clean. But there was just a really powerful feedback loop between those two. And a lot of people fixing one or the other, usually there's one major driver.
Okay.
Right, one primary and then maybe one that's kind of going along for the ride. For her, it was like two major levels of instability, and we had to fix both because we couldn't get her out of the chronic pain spiral without addressing both things at the same time in a really aggressive manner.
Places.
And she had so much torsion and twisting through her leg that her femur came in, her femur was turned in, but her tibia was turned out, and then her foot was turned out even farther.
Jeez.
That's just a biomechanical nightmare to start to apply load to. So every time she would push, her knee would hurt, her hip would hurt, her back would hurt, her feet would hurt, everything would hurt. I mean, so yeah, look at it. Yeah, like, of course it hurt.
So now that we can see how aggressively off that is, what were like some of the moves that you started her on? How did she progress from there?
So at first it was all about getting her TFLs, okay? Because that was the muscle that was yanking her in. Okay, so getting TFLs released, massage, mobilize on a roller, stretch it, get massages, whatever you got to do, right? Then we had to release her hamstrings, because her lateral hamstring was really tight, and that was causing a torsion in that lower leg as well. And then her calves were really, really tight, particularly on the lateral side, and so that was creating even more torsion force through that lower leg.
Okay, cool.
And so it's just releasing all those muscles that were holding that torsion pattern in place. And then we had to go in and really consciously figure out how to turn on her TFL, her psoas, and then her ankle stabilizers, the intrinsic arches of her feet, that type of stuff. And so it was a lot of like static clamshells at first, where you're learning to fire this, static front leg raise lying down, static front leg raise to get psoas turned on, because she walked with this sort of sway. And so there's no psoas work when you have an unstable gait pattern. She's swinging her leg through with her adductors rather than driving her leg through with her hip flexors.
Oh, I see. That's interesting.
Okay, and so her hip flexors end up getting atrophied. Pelvis gets even more unstable. And so we had to fix all that. Then it was getting her ankle stabilizers really strong. And getting the intrinsic muscles of her arch turned on. So a lot of big toe splays, a lot of toe presses, banded toe presses, lots of balance beam walking, lots of stuff where her feet had to physically curl, grip a surface, and turn on, so that way her arches were nice and strong and they could fire so that they could hold the rest of her body up.
Cool. Gotcha.
And then we got her up to doing like full straight bar deadlifts with
Really?
150, 160, 180 pounds. Like, she got strong.
That's awesome.
Full like 12 to 18 inch step ups with like 20-pound dumbbells. Like, she got strong and was able to translate that force.
When she was like making progress, I would imagine that that's pretty encouraging coming from where she came from. Mm-hmm. Like, do you remember when like, I mean, it's kind of a slow process, so you probably is not like, oh my gosh, this is happening. But do you remember like her feeling like, oh my gosh, okay, I might have some hope here. I might be able to like, I might see the light at the end of the tunnel. This is awesome.
Yeah, I think it was just those lifestyle moments when she's like, I got out for a hike with my family this weekend.
Gotcha. And she could celebrate that.
And she's like, and it didn't hurt. I'm like,
that's cool.
I love it.
Yeah.
I love it. And in the gym, you know, there's those big, like, you get to deadlifts for the first time, you get your glutes firing in a clamshell. Like around here, like, we go, glutes firing in a clamshell, and then the whole gym is like, woo, let's go. Exactly. and the person's like, I'm just laying here with my leg up. And I'm like, no, you're not just laying there with your leg up. Now your pelvis is going to be stable while you walk. Yeah. Let's go. Yeah, that's awesome. And so, you know, there was a lot of like victories, like biomechanical victories, but the lifestyle ones are really the ones that hit people in their hearts.
Yeah, because that's when it starts to add up. It's like all the work I'm doing in here starting to translate to my real life.
Yeah.
Yeah.
You know, and then like deadlifts and step ups where you're like doing things where you're like, I never thought I'd be able to do that. Mm-hmm. You know, for her, because she never thought of herself as like strong. Well, she's doing full sit-ups and planks and dynamic planks and bear crawls and, you know, deadlifts with her body weight. Like, she's strong. She's doing athletic stuff. And so she's like, I never thought I'd be able to do this. She was staring down the barrel of double hip and double knee surgeries.
And just to be clear,
she did not have to have those surgeries.
She didn't have to have surgeries.
Yeah.
Which is like, I mean, we could talk about that for a minute too. It's like, think about those paths right next to each other, right? It's like one scenario, what is the scenario she went through and what could have it looked like? I mean, not only the money, but like the emotional state, it could have affected her. I mean, her life could look different now.
Yeah, I mean, once you start having surgeries and cutting through connective tissues, and I mean, once you start disrupting tissues, you get contraction and scar tissue around those incisions. And that just creates more adhesion, and so those tight areas that were her problems become scar tissue rather than just connective tissue tight problems. And so inevitably, I think they would have just made it worse. Yeah. Long term, it would have just made it worse. She might have got some short term relief, but not fixing the underlying root problem and then creating more tissue damage in the long term.
Yeah.
joint pain is one of the few conditions that truly requires a whole person approach.
Yes.
Okay, our medical system is very set up to be a specialist heavy system. But joint pain and chronic pain is the exception to that rule, which is why our medical system does such a poor job of successfully treating it. Somebody who comes in with joint pain, they have a combination of central nervous system dysfunction, peripheral nervous system dysfunction, biomechanical dysfunction, immune system dysfunction, and so you need someone who is a generalist, who can look at multiple systems and how they're interacting with each other, not a specialist. Because if you go to a specialist, they're going to look through the keyhole of their specialty.
Right.
And they can tell you what they see, right? The surgeons that she went to told her what they saw and gave her a possible solution, which they were capable of delivering, but they're giving it with their limited vision of not knowing what biomechanical dysfunction looks like, without knowing how a joint is actually supposed to move out in the real world when it's loaded. And that's a very limited perspective.
Yeah.
And they will, admittedly, they go, well, movement isn't my area of expertise. That's where it goes over to physical therapy. But they're making the recommendation to get surgery or not. And so you can't separate structure from function, because those two things are one thing.
Yeah, just because they're separate from a business standpoint
doesn't mean they are in the real
body.
world.
Yeah, it's like whatever happens to this anywhere like affects everything about me. Yeah.
Yeah.
That's good. Okay. Yeah, anything else about her story that maybe kind of jumped out we should touch on?
Yeah, I think the 2 to 3 big takeaways from Katelyn's story that I think I want the viewers to get is, she was exactly like everybody else walking through a pain journey. There was so much uncertainty around what the problem was, what's going to be the fix, should I try the 15 different things at my disposal. And she had tried PT, she had tried chiropractic, she had tried massage, she had tried injections, she had tried, I mean, you could just keep going.
Okay.
She tried everything. And so you're facing this huge level of uncertainty, right? And she chose to act with wisdom and ownership of her body in the face of uncertainty, rather than fear and victimhood, which who could have blamed her if she did, right?
Yeah.
Like 13 years old in this really terrible spot, dealt this hard hand, but instead of going, I mean, a lot of people blame their pain on genetics.
Yeah.
She actually had a legitimate case against genetics, which is very rare. She actually had a legitimate case, but rather than go, oh, well, that's just, that's just the way it is, she said, no, what can I do about it? That's so powerful.
Yeah.
That is so
age,
powerful. Yeah.
That's cool.
And so, I mean, I think it's just a credit to her. I think it's a credit to her heart, and I think it's a credit to her parents.
Yeah.
They demonstrated that, obviously. So I think that's really powerful.
Cool.
I think the other part of that, the other thing, is she learned the cards that she was dealt, and she learned how to play them well. Okay, so she was dealt the hand of cards that she was going to be hypermobile, right, all the way to that far side of it. But she played her hand well and said, okay, I'm going to have to spend 3 to 4 hours a week doing strength work to pull me back over to a healthy and balanced musculoskeletal system.
Gotcha.
Right, and so it's going to look different. You're going to get the 35 to 65-year-old guys who are like strong, But they're so inflexible, right? And so they'll all end up with knee replacements and hip replacements and all the replacements because they'll destroy their joints from immobility. And then you'll get on the other side the women who are hypermobile, right? And because they're hypermobile, stretching will feel good, so they'll tend to go to things like yoga and things that only further that hypermobility, because that's what they're good at. And so we tend to work in areas of strength, not working to even out our weaknesses.
Gotcha. And that's what you guys are paying attention to when you're on the floor, when you're bringing people in. It's not necessarily like, or the balance. You're trying to find the balance between the two.
The North Star principle that we use is that a healthy, pain-free body is adequately, not adequately mobile, stable, and strong with a healthy immune and nervous system.
Cool.
Okay, so you can't just have mobility and expect to be pain-free.
Right.
You can't just be strong and expect to be pain-free. You have to be mobile, stable, and strong with a healthy nervous system and immune system.
That's so interesting.
That's what taking that whole person approach looks like. Because when you take that approach, it forces you to look at your midbrain and parietal lobe. It forces you to look at your peripheral nervous system. It forces you to look at your immune system and your nutrition. It forces you to look at your joint range of motions. It forces you to look at your neuromuscular firing patterns. It forces you to look at your strength levels and realistically evaluate if they're measuring up to your lifestyle or not.
Gotcha.
Right? And so that North Star principle forces you to take a whole person approach. That's what's so powerful about it.
After Katelyn kind of went through the whole program, did you get to have conversations with like her parents kind of after the fact? Just like,
yeah, we had like regular sit down chats about it. And I think they were just really grateful and really, really glad that she was on a different path. You know, you don't want to see your 13, 14-year-old daughter starting to have 4 surgeries in a year at that age. Like, that just puts her on a whole nother trajectory. And so, I think they were just really grateful and really just profoundly, like, glad that she was on a different course.
That's cool.
Yeah.